Welcome! I understand you're interested in our skilled nursing center. We're so glad you're here. My name is James, and I'd like to take you on a trip today. My job here today is to explain the admission journey and introduce you to some people you'll meet along your way. By the end of our trip, I hope to provide you with a better understanding of how a stay with us operates. So let's get to it. When you were first introduced to our center, you likely met some of my friends. You met a central intake coordinator. For today, we'll call her Central Intake Sarah. You also met a patient transition coordinator. We call her Patient Transition Patty. Our soon-to-be patients often spend time with our Central Intake Coordinator, Sarah. Her job is to help with the transition to the center. Patient Transition Patty often assists patients when preparing to move to a skilled nursing center, especially those patients that have spent time in the hospital or acute rehab centers first. Think of Central Intake Sarah and Patient Transition Patty as travel agents. They're helping patients get to the right place at the right time, and all of the documentation needed to move to the skilled nursing center or other appropriate care setting. You may be planning to move to one of our centers, or maybe you've come for a tour and need more information. Either way, you're introduced to the associate we call a healthcare navigator. The healthcare navigator's job is to walk you through everything that happens prior to your admission. We call it pre-admission. The healthcare navigator works with Central Intake Sarah to make sure we have everything needed to prepare for your admission. Today, for the purpose of this journey, we'll call our healthcare navigator Hannah. You'll also likely meet Faith, our finance controller. More about her later. I know healthcare can be complex and confusing. That's why we created the role of healthcare navigator. Think of the healthcare navigator as your tour guide, who helps you understand the CHSGA healthcare system and all that it has to offer, from home health, to care management, and even hospice services. There are several other people involved in your admission and stay who I want you to quickly meet, and then I'll go more into what they do prior to your admission, during your time with us, and your discharge a little later. Each of these people are part of your team. You've already met Central Intake Sarah, Patient Transition Patty, Hannah the Healthcare Navigator, Faith, our Financial Controller. But now I want you to meet some other people who you'll encounter on your journey. Dawn, the Director of Nursing. Sue, the Nurse Supervisor. Chandler, the Charge Nurse. Steve works in social services. What you didn't see prior to your admission is that Hannah the Healthcare Navigator also talks with our team back at the center. The team I referred to is a group of people we call an interdisciplinary team. This team is a group of skilled professionals from all different disciplines, from clinical services, finance, social work, to dietary, and more. The team, along with the Director of Nursing, reviews your admission, including all the clinical considerations that everyone needs to be aware of before you get here, and things to know while you're here. The healthcare navigator will also obtain all the proper paperwork from you, including completing the advanced directives checklist and obtaining your specific advanced directives. They'll then schedule what we refer to as a 48-hour care plan meeting. Faith, the financial controller, will be meeting with you at the time of your admission or shortly after to provide financial counseling. This will provide the opportunity to discuss all services and payment sources available to you, as well as probable payment rates for such services. She'll be able to provide you additional resources, including how to apply for Medicaid if needed. She'll be available to address any financial needs and concerns you may have on your healthcare journey. Meanwhile, remember Don, the Director of Nursing? He's an important member of your care team. We often call the Director of Nursing a DON. Get it? Don will be reviewing your documentation to learn more about your current and past medical history. This allows Don to adequately prepare the team to meet your care needs. He'll clarify any care considerations with the healthcare navigator he may have. The Director of Nursing then communicates with the physician, the rehabilitation director, the nurse supervisor, and/or the charge nurse. Don, the DON, tells them all about you and your upcoming admission. The DON, or in this case, Don, will oversee your admission and make sure it's as seamless as possible. We want all of our patients to feel warmly welcomed and well cared for. Now, meet the nurse supervisor. You remember Sue. Once the nurse supervisor knows you're coming and understands all your specific needs, she prepares for the unit admission. Sue, the nurse supervisor, reviews the admission orders and inputs the pre-admission orders to begin working with the pharmacy to receive the medications you need, which means she makes sure we have everything we need for you upon your arrival. Sue, the nurse supervisor, is also responsible for initiating your plan of care and the certified nursing assistant's plan of care. The nurse supervisor will then meet with the charge nurse. Now, you get to know Chandler, the charge nurse, more in depth. Chandler, the charge nurse, reviews the admission orders again, completes what we call a patient assessment. He'll then update the plan of care and the CNA plan of care as appropriate. What's a plan of care, you ask? A plan of care is the roadmap for the team to know how you would like to be cared for. For example, if there are any preferences you have around meals or daily activities, it'll be included in the plan of care. If there are any safety interventions needed to assist in preventing hazardous events like a fall, the team will determine the best safety intervention and use the plan of care to communicate those to the team. Chandler, the charge nurse, oversees making sure those safety precautions are implemented. While there are a lot of people on the team, I want to introduce you to one more person now. He works in social services. You may remember Steve. Steve in social services makes sure the center understands your wishes included in your advance directives. He makes sure that you understand your rights as a patient and can assist you with obtaining resources you may need during your stay. If you have any concerns during your stay, Steve will lead the charge to make sure those concerns are addressed. An interesting thing that Steve in social services does is he begins determining your discharge plan. Yes, even before you get here. Steve works with you to determine if your stay with us will be short-term or long-term. Based on the answer, he'll begin a process to further ensure your care is seamless from start to finish. For example, if you're a short-term patient, there are several options for discharge based on your specific needs. These options sometimes include home, care management, home health, and sometimes hospice. Social Services Steve will develop a proper plan of care for discharge depending on your unique needs, and will then refer you back to, guess who? You got it, Hannah the Healthcare Navigator. As I mentioned earlier, the Healthcare Navigator is there to guide you on your healthcare journey. If you're a long-term patient, Steve in Social Services is still right here with you. He'll develop and implement a plan of care for you, as well as determine any need for care transitions. If you will need continual case management, ISNP, Hannah will introduce you to a benefit that may help ease the cost of care for you and your family. If staying with us long-term, Hannah will introduce you to a care offering called Georgia Health Advantage, which is a special needs Medicare Advantage plan specifically designed for long-term stay guests. In the event you need to leave our center, Social Services is there to coordinate that transition as well. Our goal is to make your stay with us a warm and positive experience. Let's talk about discharge now and how that works. Essentially, we do the process I just went through, although backwards. Hannah the Healthcare Navigator works with Steve in Social Services and reviews your discharge plan of care. Social Services will then schedule a meeting to discuss the discharge plan and communicate the plans to the nursing staff. Steve in Social Services will also make arrangements for any post-discharge needs that you may have, including scheduling a discharge planning meeting. There, Steve will discuss your needs for discharge, including any durable medical equipment needs, home health, and follow-up appointments. Steve may also introduce you to our care management team. In certain locations, they provide transitional support when leaving a CHSGA service. How's that for service? After you leave us, you can expect to hear from Steve in Social Services within 2 to 3 days, just to check on you and see how you're doing. Meanwhile, remember Dawn, the Director of Nursing, Sue, the Nurse Supervisor, and Chandler, the Charge Nurse. They also know about your discharge, and each have specific roles relating to your smooth departure. Let me explain what I mean. Sue, the nurse supervisor, will identify any education needs and communicate that to the charge nurse, Chandler. Sue, the nurse supervisor, will complete the medication reconciliation and notify the pharmacy of your upcoming discharge. This process helps you to determine which medications you need to continue when you arrive home. She'll also communicate any rehabilitation needs you may have to the rehab director, which may include a home evaluation. Sue will also communicate your discharge to the physician in charge of your care and obtain any needed orders for your discharge. Just like the charge nurse had responsibilities when you arrived, Chandler, the charge nurse, has responsibilities when you leave. Chandler will provide any needed education to you and your family. He'll complete another patient assessment, a new one, prior to you leaving. He'll provide the report to your new facility if you're moving somewhere else. He'll review the discharge orders and provide any medications and/or prescriptions as appropriate. Lastly, the charge nurse will provide a written copy of the instructions, discharge papers, so you can refer to it once you arrive home. We know that with the excitement of going home, the information we share may be overwhelming. We want to be sure that you have a guide you can refer to if you have questions. Don't hesitate to call us if you have questions. Okay, back to the Director of Nursing. You remember Don? Don has been directing the overall discharge process for you. He ensures appropriate communication to the interdisciplinary team members. Because we always want to be better today than we were yesterday, Don, the Director of Nursing, reviews the entire process and looks for opportunities to improve. Chandler, the charge nurse, has one final but important job to do. He completes documentation, and you are on your way and discharged. We're sad to see you go, but are grateful for your time with us. Steve in Social Services will follow up with you wherever you go in the coming days and weeks to make sure everything is going smoothly for you. He is always available to answer any questions you may have. I hope this video explained what you can expect as it relates to your care journey. We are grateful you chose us and look forward to serving you with care and respect.